everyone, I'm Brooke Richardson, and I'm really excited to be presenting today at the ECV conference. So I wear a couple different hats. I'm a researcher at Brock University. I teach at Ryerson University in Toronto, Ontario, and then I am the president of the Association of Early Childhood Educators of Ontario. So kind of come to this, and I'm also an early childhood educator. So I kind of come to this from a policy perspective, academic perspective, and early childhood perspective. I'm really excited to be a part of this larger research team that includes Kay Cook, Rhonda, Breitkreuz, and Ben Wu from both Australia and Canada. And today I'm going to be presenting one aspect of this bigger project that we're kind of working on that looks at how ECEs were positioned and are positioned in pandemic childcare policy responses in Australia and Canada. And I have to admit, this is my third take at this presentation. I'm really trying to get a little bit shorter, so hopefully I achieve it. So the first question is, why Australia and Canada? I think the bottom line is that I've attended conferences before, and we kind of always, Kay and I have connected several times and expressed similar ideas and trends that happen in our different jurisdictions. So we thought, especially in relation to the pandemic, what's happened? Australia and Canada are both liberal welfare countries with liberal welfare regimes, which is just, essentially a fancy way of saying childcare is driven by the market. It's a fee for service, and not necessarily something that's conceptual, definitely not something that's conceptualized as a public good. There's an increasing reliance in both countries on for-profit childcare and the rise of corporate care, which goes obviously hand in hand with that market model. And three, both countries, instead of this being a similarity, it's a difference. They have different, in Canada, the federal government has more of a hands-off approach to childcare policy. And the provinces is where most childcare policy actually happens, and decisions are made and funds flow from there. And then in Australia, it's the opposite. So federal government is responsible for the childcare policy, making policies, implementing policies, funding things, et cetera, and jurisdictions have much of a smaller role to play. However, we became really clear in the first few conversations that we needed to focus on specific areas within these broader countries, not only because, but partially because the pandemic itself has been so jurisdictional, right? Where things were happening, where the outbreaks are, where things are closed, where things are open. And so we decided on focusing on Ontario and Victoria, which are two provinces within these bigger countries, both areas that are highly densely populated. Both areas which claim to be leaders in the childcare sector. In Ontario, we have the Ontario College of Early Childhood Educators, the only province to actually have a professional regulatory college. We've also taken strides in terms of implementing full-day kindergarten back in 2010 for full day for 4- and 5-year-olds. And Victoria also, describes itself as a self-proclaimed leader in early childhood services due to their recent rolling out of their three-year-old kindergarten program. And comparing these different areas also kind of lets us tease apart these jurisdictional differences in how childcare policy works, particularly at a time when things were happening on the emergency childcare responses. Of course, another similarity between Australia and Canada is that we have a highly gendered workforce, upwards of 97% in both areas. And this is not unrelated to a systemic devaluation of early learning and childcare, which is kind of what the core of this presentation is about, kind of challenging that idea. But in Australia and Canada, ECEs are paid poorly. They tend to have more education than the average person, paid less on average than most people. And they have a history of being excluded from the social policy debate. So that's really problematic and something, although that is changing, and there's some really excellent work happening in Australia through the Big Steps campaign, and in Ontario through what's now the Rising Up Childcare campaign and the Decent Work Project, the AECEO and the OCBCC. So there are exciting things happening, but it is fair to say that historically the childcare workforce has not been a key player in, or has been, I shouldn't say they haven't been a key player, they've just been kind of, not included in the broader social policy conversation. I also want to take 1 minute, I'm going to try to do it 1 minute, to talk about professionalism. I want to say that yes, of course, I believe early childcare educators, or whatever term you use in your jurisdiction, are professionals. Would never question that for a second. What I do question, though, however, is how professionalism is thought about. And I think it's really problematic that these neoliberal ideas that are developmentally based on, child outcomes and kind of objectivist things that ECEs have to do are problematic when we're talking about professionals, and it ends up leading to essentially to what looks to me like not trusting professionals, and that we need to really have faith and trust and confidence that early childhood educators are capable and are doing amazing work, and that the core of their work is not outcomes, but the core of their work is building relationships and seeing human beings and interacting with humans, children, families, each other, and then fostering those relationships between children, between educators and families, et cetera, et cetera. So I just wanted to say that because I think I want you to know how I'm thinking about an ECE professionalism, and it's not through that neoliberal lens. So yes, there has been this shift in both areas to ongoing professionalization of the workforce. But I do, like I just said, I think there's some ways in which that shift to professionalization may actually be causing more stress on educators, particularly when any of these supports that are necessary to uphold ethical responsibilities aren't there. So I think we cannot have this conversation if we're not talking about decent wages and the working conditions. We have to address those things in any kind of conversation about professionalism, or we're not going to be talking about something that is going to be sustainable and meaningful over the long term. Okay, so back to the pandemic. We know the pandemic was gendered. Everywhere we go in the news, we're seeing headlines like these, women struggling to do it all. So they're bearing the brunt of the pandemic. These are some headlines from Australia and Canada. We know women were more likely to lose their jobs. We know mothers who are trying to work and be caregivers are struggling big time. We know they're taking hits for the career hits and making huge sacrifices to be able to navigate their conflicting roles as caregivers and employees. And then, of course, we know, maybe the world doesn't really get it, but we know that ECEs who are, again, female, have experienced major upheaval over the past several months as childcare centers closed, reopened, emergency childcare centers opened. We're not, an infinite uncertainty in what our jobs are going to look like, if they're going to be there, if they're not going to be there. It's been incredibly stressful. So we don't know from the perspective of ECEs what the impact has been, but there is research in progress that we're working to trying to get those perspectives. But what we do know is what happened at the policy level, right? We can say, well, this is X, Y, Z happened, and this is how it positions ECEs. And that's what I want to talk about. And I included these two photos, not because they represent professional early childhood educators, but kind of the opposite, because it kind of shows what our work has been broadly been reduced to or conceptualized as throughout the pandemic, right? And it's true, there's probably a lot of time spent washing toys, sanitizing toys, doing these extra things, and that we've had to stay physically distanced from children and children distanced from each other. And these are not things that are they're certainly not helping our struggle towards being seen as professionals and seen as valuable members, professional members of society. And that's kind of what I want to talk about. Not to say that this work doesn't have to be done this way, or that, sanitizing isn't important, but it's not the crux of what we do as professionals. Now, this is where I really have to cut down big time here in my time, because I can't go through all of these things. But what I want to say is, in Ontario, essentially what happened, childcare shut down. They realized pretty quickly after all childcare was mandated closed by the government, right, in March, that we need some childcare for emergency workers because our society is going to completely shut down. So childcare for essential workers was opened in partnership with municipalities and governments and not-for-profits, where it was fully funded. Parents didn't pay any fees, parents who are essential workers, obviously. Key things to note, however, are that early childhood educators were excluded from being considered essential workers, even though they're working in the essential service that childcare has been defined as. So that's kind of puzzling. And then, so this goes on where it's only emergency childcare opened. And then June 9th, we get the kind of abrupt message from the government that childcare is allowed to reopen, and 2 days later. So this is, again, kind of a mad scramble. No one knows what to do. Everyone's still scared. Very few centers actually open because no one was prepared for this, and no one has they have to meet additional health and safety protocols, reduced number of children. They don't have the budgets. They're not being given the supports to be able to actually do that. A couple of weeks later, all emergency childcare centers have closed. And so the sector's, trickling open here and there, nowhere near the majority of centers are open. And those that are open are operating at reduced capacity. July 7th, we get slammed with the launch of the Child Care and Early Years Act regulatory review, which is something that was supposed to happen completely separate from the pandemic, where we look at the regulations that we have in Ontario and see what's working and what's not. But this is not the time for that, because obviously you need to engage with the sector in a meaningful way. And the sector is kind of in crisis. We're trying to reopen. We're trying to figure out what we're supposed to be doing, how we're supposed to be doing it, basic things like PPE, like who can come, who can go, when does a child go home? When do they need a COVID test? All of these things. And then there's these regulatory reviews. So that's a little bit overwhelming. So that's happening over the summer. September 1st, childcare centers are now permitted to reopen to full capacity, as opposed to, this modified capacity. And it's important to note at this time that still the majority of childcare is not open. More and more centers are open, but centers are operating at significantly reduced capacity. So this announcement that they can be full capacity is again kind of like, where does this come from? What does this mean? And where's the money to do any of this? Then we get money, but from which the Ontario government announces through the Safe Restart Agreement, but that's a federal initiative, 147 million to childcare in Ontario, which is great. We much needed. A lot of that went to just simply purchasing PPE, because still ECEs didn't have access to that in any sort of systemic way. And then October 2nd, Ministry of Ed releases their proposed regulatory amendments, which are not good. So the regulatory amendments, they're saying, again, this is something they had planned to do before the pandemic, but continued to do in the middle of the pandemic when the sector is already extremely overextended. Increasing the number of children in each group of children, and more infants and toddlers in each group. Permitting non-ECEs to practice in positions currently limited to ECEs, particularly in kindergarten programs and before and after school programs, and creating a registry of unlicensed childcare providers. All three of these things, which completely undermine the value, respect, recognition, profession of early childhood education. A major slap in the face, essentially. And to boot, it's extremely hard to organize anyone, because everyone's still struggling through. Our numbers are way up, and we're trying to just kind of get by day to day. The federal government was a huge stabilizing factor for us. I mean, even though they don't do childcare policy, they did do some key things. So the Safe Restart Agreement, which I didn't include there, but I did on the last slide, they provided income stability through the Canadian Emergency Response Benefit, for which a lot of early childhood educators and childcare professionals qualified. It was basically a $2,000 a month income. And that's more recently been rolled back into the EI. But what they did do is, because of this, huge coverage, maybe huge is a bit too generous, but it certainly increased coverage and the importance of care to the functioning of society and childcare, and the amount that women, particularly mothers in this case, are struggling. The federal government made an announcement in their speech from the throne for a significant long-term sustained investment to create Canada-wide early learning and childcare. Over to Australia. And again, I'm really going to try and get through this quickly, and I just don't have time to go into the itty-bitty details of it. But suffice it to say, similar to Ontario, childcare is seen as an essential service. They, instead of the widespread CERB that we had, they had this job keeper payment. So people who lost their jobs as a result of the pandemic or were laid off were able to get their wages covered by the government. And for ECEs, this was about 70%. Of course, not all ECEs were eligible because of the parameters that were put on this. And again, that was not specific to ECE, but it did include ECEs. And then they had basically 3 packages that came out. So the first relief package, such governments were funneling money directly to childcare centers, again, not distinguishing between for-profit or not-for-profit or any of that, to keep them open during the pandemic, because obviously enrollments were down. And then, so that happened for a certain period of time. There was May 1st, they added supplementary payments because they recognized that not all ECs were qualifying for the job seeker program, particularly those working in home childcare. So there was a little bit more money that came in to support the workforce. Then we move from the relief package, kind of the highest level of support, to the transition package, which, so the amount of money going into childcare is reduced. And interestingly, the job keeper program comes back because they're entering into their second wave of the pandemic. But this time ECEs are explicitly excluded from the job seeker program. So again, major slap in the face. August 5th, pandemic is particularly bad in Victoria. The federal government channels monies specifically to Victoria to open childcare for essential workers. Province of Victoria is responsible for figuring out who those people are and issuing permits to essential workers so that they can access childcare. And then the recovery package, which is for Victoria only, we're moving back to the typical funding model, the childcare subsidy that's usually used. There is some additional money still coming in to stabilize the sector from the government. Again, there's no job seeker anything going to childcare providers, but there is some stipulation that the payments that they're receiving from the government, some of it has to go to wages. So I'm going to skip this only because I think I talked about it already. Yeah, the point is that Victoria went back into lockdown, issued these permits. There was more money going in this one jurisdiction, but JobKeeper was not there. The question becomes, are ECEs a policy oversight, or is this a deliberate attack on educators? And obviously, if this were a live conference, I would open this up for discussion because I think it's a really interesting conversation to have. My own 2 cents is that I do see this as a deliberate attack on educators because in the beginning, well, particularly in Australia, ECEs were included in this widespread public policy, and to be explicitly excluded in phase 2, or not phase 2, in stage 2 of the pandemic is an attack, right? Is saying we don't value the work you do, even though everyone's talking about how important care is and childcare is for women to be working for gender equity. We still think that you're not valuable enough to include you in this federal program. So that's major. And then the same thing in Ontario. despite everything ECEs were doing to try and keep childcare open, to try and serve and care for children who in their care, they then had to deal with, and not having systemic support they needed throughout the entire pandemic to do that, to then have to deal with regulatory changes that completely undermine the value of their work, what they do, through the regulatory changes, having more children, less support, and not even qualified ECEs is just, again, it's hard not to just feel like it's a major slap in the face. What does this mean for children and families? It means children aren't going to have access. They haven't had access to the care they deserve and they need throughout the pandemic, and that's even more compromised moving forward, given the instability in the sector. Same for families. And then educators, what does it mean? It means we have more barriers than ever in trying to uphold our professional ethical responsibilities of practice. And it also means that I think all three groups need to, we need to use our voices. We need to have our voices heard. No one's going to come to us necessarily to ask what we think. So we got to get it out there and go to them and put things out. And I know in Ontario, I have so much respect and envy is not the right word, but admiration for all the work that's been happening at the AECEO and the OCBCC to try and get ECEs out, holding a virtual rally. There's some ECEs who took the initiative to make a video of how ECEs have met the need for care during the pandemic and how we've stepped up to kind of challenge these other ideas about what it is that we do that are very neoliberal, like input output. And then I know that the Big Step campaign in Australia has also been really active and trying to get ECEs out there. And again, I'm not as familiar with that, but I'm sure there's things happening and to reach out. And I would also say, why not reach out across jurisdictions? There's nothing, we're in a pandemic, everyone's online. There's nothing saying that we can't be supporting each other. And so let's do that however we can. And at the AECO, we're working with the coalition to do a Rising Up campaign where we're sharing stories about early childhood educators with the idea that our voice, our experience, our reality matters and needs to be a part of the public policy conversation, which it has for too long not been. So I also, I guess, extend an invitation to those of you working in Australia, let's connect. Or other places. I just heard there's 50 people from 51 countries attending this conference. So that's my presentation. Hopefully it will be available online. I'm just quickly scrolling through the references. And again, I didn't include the references in the text because I just thought it was a bit overwhelming. But that's some of the literature that I've drawn on to pull this presentation together. So thank you so much for your time, and I look forward to connecting with some of you soon.